NA is a 63-year-old woman presenting to the emergency room with hallucinations and impaired cognition. She was on a boat when suddenly the world turned dark. The deck that she was standing on morphed into a tongue as the boat became a demon that swallowed her alive. When it was over, she could still realize that this was just a hallucination, at least for now. But why did that happen? 1 month earlier, NA was celebrating her 63rd birthday. It was a fun celebration with friends. Everything was great, nothing was out of place. 2 weeks later, NA was driving when suddenly, all the cars started driving backwards. They were zooming towards her. She didn't know what was happening. She panicked. She stopped on the side of the road to catch her breath. She could have sworn that she saw something weird, but everything looked fine now. She didn't know what that was. In this emergency room now, after the boat swallowing incident, the medical team examined her. They noticed that NA had phonemic paraphasia, phone from Greek meaning voice, eme referring to a unit of sound to distinguish one word from another, and para meaning abnormal, like how it's used in paranormal, and phasia meaning to speak. Her spoken voice created abnormal sounds. When they asked her what this object was, she mumbled, telecone. When they asked her what this liquid was, she said, water. She couldn't spell the word world backwards. She couldn't answer when they asked her what year it was, and she couldn't make sequential subtractions of 7 from 100. She was a doctor herself, and when asked if she could recognize the cognitive exam that they were doing, she stared blankly into the void. They asked her to remember the spoon, the toothbrush, and the watch. 5 minutes later, with an empty stare, NA could only remember spoon. Clearly, something was happening to her brain. Doctors looked into her medical record for some clues. NA had Hashimoto's disease. This is also known as chronic autoimmune thyroiditis. Itis meaning inflammation of her thyroid due to her immune system attacking it. Chronic meaning something had been happening for a very long time. She had a lifetime of hypothyroidism, low thyroid function that needed thyroid hormone supplementation for her body to function normally. In autoimmune disease, the immune system doesn't always just attack one organ. Sometimes it attacks the brain. This causes encephalopathy, apathy referring to a suffering and encephal referring to the brain. This is rare, but it's not unheard of. Hashimoto encephalopathy fits NA's problem, delirium, rapidly progressive dementia, and a history of thyroiditis. Two things are going on here. The first is that her problems right now are not immediately life-threatening. It's not a stroke, it's not a heart attack, there's no blood clot stuck somewhere in her body. Her airway's clear, she's breathing, her heart's pumping blood. So her case is a real problem, but it's not life-threatening in seconds to minutes. Which leads to the second point. Steroids fix Hashimoto encephalopathy very quickly. They blunt the immune system, stops it from attacking the brain, and then the brain comes back like nothing happened. So the medical team give NA steroids. In just a few hours, she kind of came back. She remembered that she did come to the hospital, but she was still a little groggy. Doctors gave her a prescription for some more steroids to pick up at the pharmacy. If everything is fixed after this, great. Follow up with your doctor, tell them that you had this flare-up, and they'll know what to do. And NA was on her way. It seemed to work for a couple of days, but very quickly, her body would reveal this wasn't Hashimoto encephalopathy. Hey, quick question. Have you learned a couple of things so far from this video? There's a lot more to come, but if you have, and you're not subscribed yet, really appreciate it if you did subscribe, and then come back to see the video that I post next month too. I make these videos for fun, and I've done one a month, every month since 2017. I go through every single part of the process with a little help from some of my colleagues to check me on what I'm saying, because I genuinely enjoy making these videos, and I think it's important to show people how we think in medicine. Thanks so much. Appreciate you. 2 days after the hospital, NA had a friend over at home. She was okay again, but as this day passed, the friend noticed that NA would slur her words, and then they noticed that her shoulder would keep twitching. NA started feeling vertigo. Day suddenly became night. Her house was swallowing her alive, and when it was over, she had no idea where she was. She didn't know what time it was. She couldn't even answer the question, "What is your name?" as she's brought to the emergency room again. Last time she could remember spoon from toothbrush and watch. This time, she couldn't even name the objects. She started having delusions and screaming spells in front of the doctors, completely oblivious to anything that anyone was saying to her until finally, she'd suddenly just sit quiet, staring off into space, totally unresponsive. Those steroids didn't work. This wasn't Hashimoto encephalitis. Her cognitive decline has worsened, and now myoclonic jerks are involved. Clearly, whatever she has progressed. Doctors draw blood and send it to the lab to test. They do a brain MRI, and while they wait for the results, they write down a list of problems that NA could have. They need to reason out why each one is not the problem, and the remaining one that can't be ruled out because all evidence points in favor to it is the diagnosis. Not Hashimoto's narrows down the list. NA's problem started 2 weeks ago, and this pace is important. If she deteriorated like this in 14 seconds instead of 14 days, you would think of a different problem. Typically, seconds mean a brain blood vessel problem, a bleed or a clot, but encephalopathy, like NA's, isn't vascular. Stroke patients don't have it like this. Something that can cause her problems is toxic, illicit, illegal chemicals. That's highly unlikely because she's currently being examined by doctors. She didn't take anything in front of them. Toxic effects can happen over days. The medical team did a drug screen and found nothing, so not toxic. What about not having enough of something in the body? That's the opposite of toxic. It's a nutritional deficiency. Those can cause dementia-like symptoms. Vitamin E, B12, thiamine, B1, and copper. But the blood test found the right levels for all of these. She was given some of the vitamins even before the blood test just in case, but nothing improved. So this wasn't the issue either. The brain has a part dedicated to controlling movement. It's called the cerebellum. NA had movement problems that recently appeared. Something might be wrong here, but there's a problem. Cognition happens in the cerebrum, a different part of the brain. She had cognitive decline first, meaning whatever's happening to her might have spread to her cerebellum, and it did so over days. What's something that can move like this? Well, microbes that cause brain infection can do that, but almost all of the virus, fungus, and bacteria cause fever because they get into the brain from somewhere else in the body, and then in that travel path, the immune system detects that something's wrong, but the pathogen has already gotten into the brain by then. NA didn't have a fever, but she could still have an infection. The brain and the spinal cord are cushioned and protected by a liquid called cerebrospinal fluid, CSF. If there's an infection in her brain, then the microorganism might be floating around here. They stick a needle into her back to collect the CSF to test. Results from her brain MRI returned. When doctors looked at both, they found out what was happening. NA had a brain infection. The pathogen was in her cerebrospinal fluid, but it wasn't bacteria, it wasn't a virus, it wasn't fungus, and it wasn't a parasite. In her brain was something that's normally found in all humans. At an earlier time when our technology wasn't as sophisticated, we wouldn't have even known that anything was different about this. But we know now, the thing that's in her brain is a slightly different version of something normal, but just for some reason, one small part folded the wrong way, and for reasons that we don't currently know or understand, because that one thing folded the wrong way, her entire brain is now collapsing on itself, forcing irreversible neuronal damage. She knows that they're hallucinations now, but very shortly, she won't know that they are. These things are called prions, found in her CSF and consistent with signs and symptoms. NA has sporadic Creutzfeldt-Jakob disease, CJD. The cognitive decline, her psychotic symptoms, the rapidly progressive motor dysfunction, all of these confer poor prognosis. She may not have much time left, as her family was notified. But she was fine at her 63rd birthday just a few weeks ago. How did this happen? Where did the prions come from? This is the problem with prion disease. In many cases, we don't know where it came from, but there's a couple of things that we do know. Early 1700s, Spain, shepherds noticed that their sheep would sometimes acquire a strange behavior. They would rub their backs and scrape them against fences to the point of wool loss. When this appeared, it would only be a matter of time before these sheep would struggle to swallow while eating, they would waste away, malnourished, and then it would be over. The problem is, once this appeared in one sheep, others would follow suit. Sometimes the whole flock would be lost. The sheep would walk funny, they'd behave strangely, they'd lick their lips excessively, they behaved like they had lost their minds, and then they weren't alive anymore. They called this scrapie, and they didn't know why it happened. This was the 1700s. Bacteria hadn't been classified yet, but even 100 years later, in 1875, when bacteria was formally described, it still didn't explain scrapie. In 1892, Dmitry Ivanovsky found that sap from tobacco plants infected with mosaic disease could pass on the disease to other tobacco plants. He ran the sap through a filter paper and then tried to see if the sap was still infectious. It was. He ran the sap through a double layer of filter paper. It was still infectious. The paper pores were small enough to hold back bacteria, but it wasn't holding back whatever made this liquid infectious. This was a new infectious organism that had never been described before. 6 years later, a Dutch scientist confirmed the findings that it was a new kind of pathogen that he called Contagium vivum fluidum, a contagious living fluid, and he used the Latin word virus to describe it. He thought it was the whole liquid, but later evidence showed it was something 100 times smaller than bacteria, meaning at this time, there still existed infectious microorganisms that humans hadn't previously described. We had a suspicion that they were there, but we just didn't know exactly what they were. There was much more out there that we can't see with our eyes and our advanced equipment than bacteria and fungi. And this is where prions entered the scientific picture. In 1913, B.E. was a 23-year-old woman who presented to a neurology clinic in Germany because something was wrong. She lived in a convent since she was a child, and everyone there had always regarded her as different. She had had a history of an unsteady, clumsy walk, but this time something was markedly different because her legs would have random jerky movements that would cause her to fall down. She would start screaming. She would laugh that the nun was dead, that a demon is in active possession of her body, that the real girl, B.E., had already died, and it was time to sacrifice this body. This delusional thinking and psychomotor dysfunction were remarkable, but B.E. had more problems. When she spoke, she substituted and rearranged sounds within a word. Phonemic paraphasia. She couldn't remember objects when she was presented with them. Impaired cognition. She had random jerking motions of her shoulders, and she would suddenly stare off into space completely unresponsive before snapping back, confused and unaware of where she was. At first, this woman could identify faces. But as the days passed, she started forgetting faces. She forgot her own name. She didn't know where she was. Her jerks became more random. She became unable to swallow and eat food. And 3 months later, she had a 20-minute seizure. When that seizure was over, she never regained consciousness. At autopsy, meticulous samples were taken. The doctor who saw her described pathologic changes in her brain that appeared under a microscope. Back then, they had observed what different diseases did to the brain. They had already meticulously documented what the brain looked like under a microscope for patients who had those diseases. Whatever this woman had was something that hadn't been described before. Maybe it had been seen clinically in the past, but not documented like this. It didn't cleanly fit into any other neurologic disease descriptions at the time. The doctor who described this was Dr. Hans Gerhard Creutzfeldt, one part of the name for Creutzfeldt-Jakob disease. Shortly after Dr. Creutzfeldt's description of a new neurologic disease, Dr. Alphonse Maria Jakob described a series of patient cases similar to the one Dr. Creutzfeldt had described the year earlier, where patients would experience a disease marked by rapid onset, progressive, neuropsychiatric dysfunction with features combined unlike other diseases known at the time, like multiple sclerosis. At autopsy, they looked at the brain tissue under a microscope. There were slightly different features from each patient. When more doctors started contributing to this conversation, the name referring to this new disease became Creutzfeldt-Jakob disease. The problem is, no one knew what caused it. It wasn't bacteria, it wasn't fungus, and it didn't appear to be a virus, so what could it be? At the same time, a French group studying scrapie was particularly disturbed that there existed an infectious particle that was unknown. They knew scrapie wasn't caused by a bacteria, it wasn't a fungus or a fungal spore. This was a completely different area of study with patients totally different from Dr. Creutzfeldt and Dr. Jakob. These worlds didn't even talk to each other, but they had the same problem for a completely different disease. Could these be caused by a different kind of virus? A Scottish veterinarian in the 1940s stumbled upon a finding. Viruses are inactivated by formaldehyde. Taking known samples of brain and spleen from sheep infected with known viral infections, who also turned out to have scrapie, he treated those samples with formaldehyde and then injected them back into healthy sheep and goats. None of them ever got the viral disease, but 2 years later, those animals got scrapie. This affirmed that scrapie was transmissible, but it also meant that scrapie wasn't caused by a virus either, because it should have been inactivated by the formaldehyde. Forms of this experiment were done throughout the years. What inactivates the scrapie agent? Ionizing and UV radiation were used to irradiate scrapie-infected tissue. This is the radiation that destroys DNA and genetic material. That would inactivate all bacteria, virus, and fungus. But it didn't inactivate the scrapie agent. They also subjected the infected tissue to extreme heat and high pressure, which would destroy those too. And every single time, nothing happened. The tissue was still infectious. Healthy animals injected with it would still get scrapie. Whatever was causing this infection resisted all the things that destroy every pathogen known to humans at the time, meaning we're looking at something new. And a chance discovery on a different side of Earth would give new clues. In the 1950s, a group of indigenous people in Papua New Guinea were experiencing a mysterious, fatal neurologic disease. It was local, but it was only members of a single ethnicity spread across multiple tribes. This disease was marked by rapid onset, progressive, neuropsychiatric, and psychomotor dysfunction. When scientists performed autopsy on the patients, it revealed that their brains had widespread neuronal damage. This particular group of affected people had a ritual where during a funeral, they would consume parts of the deceased. They noticed that women and children were predominantly the ones to have this disease, and then they found out women and children were the ones designated to consume the deceased's brain per cultural custom. This suggested that something inside the deceased's brain was infectious, and this disease was likely transmitted when that brain was eaten. This illness was called Kuru. In the original description, they thought Kuru was caused by a virus, but they would soon find out Kuru, scrapie, and Creutzfeldt-Jakob disease are all related. In 1966, scientists took Kuru-infected brain tissue and put them into monkeys. Then, the monkeys got Kuru, meaning two things. This disease is transmissible, and something about the infectious agent, whatever it is, works in genetically similar species. A veterinarian expert in scrapie one day, by chance, came across the paper on Kuru. He saw the brain pathology slides. The spongy appearance was very familiar to him because that's something that you only ever see with scrapie. This connection between the two suggested that Kuru was a human version of scrapie. Both caused by an unknown pathogen, both cause the host to be completely incapacitated in similar ways, and both cause the same permanent neurodegeneration in the brain. They called this group of disease transmissible spongiform encephalopathy, a brain suffering marked by something that makes it look like a sponge, that can be transmitted not just from individual to individual, but from species to similar species. But they still didn't know what caused TSE. A few scientists put out an idea that's against everything that was known in biology at the time. We know that DNA encodes for proteins, which are our physical form. Biological entities pass on that information in only one direction, meaning that changes in DNA can make different proteins, but changes in existing proteins doesn't change the DNA. This is called the central dogma of biology. Bacteria and fungus cause sickness because they spit out things that our bodies don't like, and then our bodies react. Sometimes the bacteria makes something really putrid that destroys us, but sometimes it's just our body's reaction to that bacteria that totally destroys us. Viruses have genetic material that hijacks our genetic material to make proteins for itself. If scrapie, Kuru, and CJD aren't caused by any of these, but they can be contagious, sometimes inheritable, and the disease can cross into genetically similar species, then is it possible that these diseases are caused by a protein? How would that work? Could it be that some individuals get a genetic mutation that creates the wrong protein? Maybe, but that doesn't make sense because for Kuru to infect monkeys too, it means that that protein has some way to replicate inside the monkey. So if it were a genetic mutation that came from a human protein, it's not likely that that protein would induce the same mutation in a monkey as it would a human because biological information can't flow backwards from protein to DNA to make that same protein. So if it's somehow a self-replicating protein, it means that it's doing something that we aren't thinking about. While scientists were doing experiments to find this then hypothetical protein, the first reports of cows getting a strange brain disease started coming out. It would be a progressive onset gait disturbance that would devolve into falling. The animals would become frenzied and unable to be handled before becoming unable to swallow, and then they would waste away. Samples of these cows' brains were taken at autopsy, and veterinarians found a spongy appearance that resembled scrapie, meaning there existed a bovine version. This was called mad cow disease. When scientists took infected tissue from the cows and put it into sheep, those sheep got the same disease. Their brains at autopsy had the similar appearance as ones that had scrapie, just like how the monkeys got kuru from infected human brains, meaning mad cow disease, scrapie, kuru, and Creutzfeldt-Jakob disease are all caused by the same kind of infectious agent. But unlike scrapie, mad cow disease could get transmitted to humans who ate infected beef, meaning there are multiple caveats to TSEs that we're only going to learn about from experience. Dr. Stanley Prusiner ran experiments. He took scrapie-infected brain tissue and reacted it with enzymes that only break down proteins. After it was done, the tissue didn't cause disease anymore, meaning these diseases were caused by a protein. But they didn't know how the proteins caused neurodegeneration. They didn't know how they replicated. Dr. Prusiner called these proteinaceous infectious particles, shortened as prions. In the hospital, NA's situation worsened. Her diagnosis was quick because her clinical symptoms, their pace, her brain MRI, and her CSF pointed very quickly in favor of CJD. She was a very social person. She was well regarded in her community and amongst her colleagues. People who knew her from all around the country dropped what they were doing so they could go see her. Everyone knew there wasn't much time left. It was here where people saw firsthand what prion disease does. NA could recognize most people, but not everyone. Every day, hour to hour, was different. Sometimes she'd be talkative, sometimes she'd suddenly stop talking. A few days after diagnosis, she was visited by close friends who were former work colleagues. Everything seemed great, but she only recognized 3 people. There were 4. NA was still able to reminisce with them about the ups and downs of the research work that they had done together for so many years. But as the hour continued, NA started speaking slower, speaking quieter. The room became silent. NA closed her eyes. Her friends understood. She was tired. Immense things were happening. But when NA opened her eyes again, she immediately panicked. She didn't know where she was. When they told her that she was in the hospital, she demanded to know why. But even worse, it became clear she didn't recognize anyone in the room anymore. No names, no faces. She was combative. She told everyone to get away from her. But then she started speaking slower again. She forgot what she was panicked about. She closes her eyes again and doesn't speak for the rest of the day. There's been a few developments in our understanding of prions since Dr. Prusiner won the Nobel Prize in 1997 for describing them. When they were looking at CJD causing prions, scientists noticed they were normal. There were no genetic mutations in the humans who got CJD. The protein was one that was typically made in the body. The DNA didn't get it wrong. But for some reason, the protein folded a different way while or sometime after it was produced in cells. And after it folded this way, depending on the person, it forced all the other same proteins in the brain to misfold too, explaining how the protein would replicate. And when the proteins did this, the brain quickly degrades, becoming like a sponge, and then it ceases to function. The damage can migrate within the brain, possibly explaining NA's initial cognitive dysfunction and hallucinations that were coming out of her cerebrum that then became motor dysfunction involving her cerebellum just a few days later. This explains why in the 1700s, healthy sheep would just spontaneously get scrapie. For some reason, a protein misfolded in someone's brain, and over time, turned their brain to mush, making them incapable of performing functions necessary for life. And it's the currently accepted hypothesis that kuru originated sporadically from an indigenous person who unfortunately developed a prion, passed away from it, and in the funeral ritual performed by the people who consumed his brain, it was passed on to others because they weren't aware at the time of the dangers of that practice. And this is where additional discoveries are found. Other living beings produce prions, and they do it naturally to survive. Certain species of yeast produce alternatively folded proteins when subjected to abnormal environments. This helps them continue to grow when there aren't enough nutrients available to them. The genes are the same. The proteins are made in exactly the same order. It's just that they fold differently in this environment. We don't know if this means that humans who get prion disease had some condition emerge in their brain that would cause a protein to misfold. We don't even know what that condition would be. But it does suggest to us that prions can emerge from a variety of factors. When it comes to Creutzfeldt-Jakob disease, there's different types. It can emerge spontaneously. It can be passed down from mother to baby. It can be passed if human eats infected human or infected beef. It can be passed in the hospital if surgical equipment has someone's prions on it, and that equipment gets used on another person. Mad cow disease and scrapie exhibit the same patterns. But none of this tells us how to treat prion disease, and we can't just scoop out the brain proteins and fold everything back normally like a piece of paper. Just like how there wasn't anything that could be done for NA from the very moment that she had that first hallucination on the boat. We don't know how long the first prion was in her brain. It could have been years, it could have been weeks, we'll never know. It could have even been during the time that I knew her. And that's how I know this case, because I knew NA, and I knew her for almost 10 years. On April 7th, 2025, I was on the West Coast. At the time, I would sleep with my watch to track the amount of sleep that I would get when it started vibrating nonstop at 4:55 a.m. I got a text from a mutual friend who we were all colleagues together. When I looked at my watch, I saw the picture and I immediately knew something was wrong. It looked like it was a funeral picture. I immediately jumped out of bed and my heartbeat was so insane that it felt like my head was going to pop off my body. But she was still alive at this point. By this time, I hadn't seen her for a couple of years. Our work diverged, but we had worked so closely together for so long, and the last time that I saw her in person, I knew I could still pick up the phone and call her at any time, just like how I used to when we did actually work together. But after I got this text message, that would be totally impossible. On that day, April 7th, I put in a request to her caretaker to FaceTime with her. It was accepted, but when the time came, she didn't call. And when I called, no one picked up. I tried 3 more times over the next week, but I never did get a chance to see her again. Our mutual friend, the one who texted me, went to go see her in person 2 days after they texted me about this. They were in a group. NA remembered 3 out of 4 of them shortly after she woke up when they arrived, but as they were there, they saw her forget who they were. And just a little over a month later, in May 2025, her brain was no longer able to perform functions vital to life. I don't know if her airway got blocked because her brain couldn't coordinate her breathing anymore, or if it couldn't control her heartbeat and rhythm anymore, but it's usually one of those two if it happens this quickly. And then she passed. It wasn't even 2 months from the onset of symptoms. CJD happens to around 1 in a million people. I remember taking this picture with her, and I remember telling her about my videos. I had just started making them a few months earlier, and she had seen a bunch of them. She actually gave me some feedback on them, and the "take care of yourself and be well" actually came from one of our other colleagues. I had a conversation with her a few years after we took this picture, and at the time, she semi-jokingly requested that if anything should happen to her, that I make a video about her case, joking in the sense that she obviously hopes nothing does happen, but if something did, she wanted people to learn from and understand the science and medicine because she was a doctor herself after all. And if possible, preventing it from happening in even just one more person would be the best thing that we could do. But little did we know at the time, something would happen, and it would be one of the rarest possible things. Unlike my other videos, I currently don't have any recommendations on how to avoid this because we still don't know how cases like hers happen. Maybe if there's an odd local outbreak, then get out of there as soon as possible and for as long as possible. The only thing that I can think of is to support the research in this space. However, an overwhelming amount of discoveries in this space are because people from different disciplines happen to see something. That's how Kuru and Scrapie and then mad cow disease were connected together as TSE. It's how we figured out that it was a protein in the first place, but coincidentally, a protein that oddly isn't from a genetic mutation. Rather, it's a normal protein just in an altered conformation that somehow, in some people, forces all other exact same proteins in the brain to misfold. That yeast somehow makes prions on their own in order to survive abnormal environments. If this disease makes a plaque in the brain, how is this related to Alzheimer's disease, if it even is at all? What exactly are the conditions that cause the misfold that causes disease in humans? How many possible configurations are there that can cause disease? It's only endless questions, and the key discoveries will probably only emerge from connecting seemingly unrelated fields back to this, which might take a very long time, and we just don't know. But we have to be careful of those who also promise false treatments. But what I do know is that my colleague, my friend, NA, is now at rest. And I hope sharing her story will enable someone out there who might be in an unrelated field to be on the lookout and one day connect some concept somewhere that might help us move forward in this one particular area. Thanks so much for watching. Take care of yourself and be well.